Hello guys, welcome to the Medical Teaching Hub. I'm Dr. Muhammad Rafi, your facilitator here. So today we are going to learn about a topic that is very important from a lot of aspects. For example, to the in initial years of your MBBS and those who are appearing in MRCS Part A, and those who are applying for the fellowship programs in the surgery and allied, like as FCPS Part 1, MS, and others. So today's topic is the brachial plexus. I want to tell you what basically the brachial plexus is. It is basically a network of the nerves. As we know, the plexus means the network of the nerves supplying the upper arm, the upper limb. That is called the brachial plexus. Consider that your spinal cord is the working as a powerhouse. It is working as a transformer that is supplying you the energy. That is supplying you the energy, the electricity. And that electricity is coming to your home, to the different rooms, different parts of your home. That is your considering that it is your upper limb. So see in this picture, this is showing the whole of the network, and starting the terminals that are coming from the spine or from the transformer that is supplying the electricity or the power is part of roots. Not whole root, but the part of root that is called the anterior rami or the ventral rami of C5. I want to mark here with the pen. This is C5 of anterior rami. C6, C7, C8, and T1. But as per anatomic variations, sometimes it starts from C4 and ends at T2 levels. Okay, but this is the normal anatomy. So when there are the initial roots, from these roots, some nerves or some wires that are going to your home, to your upper limb, are the number one is the dorsal scapular nerve. It is coming only from C5. So its nerve root will be the C5. Okay, supplying the rhomboids. Then there is another nerve that is called the long thoracic nerve, which is very important, supplying the serratus anterior muscle. Coming from C5, C6, and C7, making one nerve, one thick nerve, supplying the serratus anterior. Then the two nerves, C5 and C6, they combine and form one nerve, one trunk. Then C8 and C8 and T1 forms another trunk, that is inferior trunk. And C7 continue as the middle trunk. So we have three trunks, then superior or the upper, middle, and the inferior or the lower trunk. So in this region or in this area, only the two nerves comes from these big wires, from the big nerves. The dorsal scapular nerve and nerve to the subclavius. So they both containing the nerve root of C5 and C6. By just understanding this single picture, you can memorize or understand their root value too. That is multiple times the headache of all the students. Then these trunks will become the divisions. Each trunk will divide into the two divisions, anterior division and the posterior division. The anterior division and the posterior division. The posterior division, the anterior division of each in the divisions. Okay, so among the divisions you can see that there is no branch at all from top to bottom. In the trunks, only upper trunk has some branches. From here it gives some branches. So the next part is the cords. Then, as we say, now we have 6 nerves, we have 6 wires. Each has divided into the two. The two means the anterior of upper trunk and the middle trunk form the lateral cord. All the posterior means the posterior of the upper trunk, the posterior division of the middle trunk, and the posterior division of the lower trunk. They will make the posterior cord, which is very thick because this has contribution of 3 posterior divisions. While in case of median, only the anterior division of the inferior trunk continue as the medial cord. Here there are a lot of branches, especially by the posterior cord. So the lateral cord of the brachial plexus gives mainly this branch. From the thick part of the lateral cord, that is the lateral pectoral nerve. Later on, it will continue as the musculocutaneous while giving a branch to the median nerve. Who completes the median nerve? That is the medial cord. Medial cord and lateral cord completes the median nerve, while musculocutaneous is the proper continuation of the lateral cord. Okay, so what are the other branches of the medial cord? Medial cord mostly supplies the medial things. Here is the median nerve. Med means the medial, and medial pectoral nerve supplying the pectoralis muscle. Medial cutaneous nerve of the arm supplying the medial part of the upper arm, and medial cutaneous nerve of the forearm supplying the medial part of the forearm, while the lateral part of the forearm is supplied by the branch of or the continuation of musculocutaneous nerve, that is called this lateral cutaneous nerve of the forearm. Now the main nerve, that is the posterior cord. Posterior cord gives a lot of branches. There was a mnemonic that is called the STAR. S for subscapular, inferior and superior. This is superior subscapular, this is inferior subscapular, but both are subscapular. S subscapular. Okay. T, thoracodorsal nerve. T is the thoracodorsal nerve, and the A is the axillary nerve. R is the radial nerve. So these are the branches. This time we are not discussing their muscular supply, because otherwise it will be a big topic. It is already a big topic. So the Next is the, yes, this is another picture, basically showing the anatomical location of the brachial plexus, because sometimes in your books, especially in the MCQs, they ask a question that which thing lies where. So this is basically the roots are present in a part of neck, that is the posterior triangle, because they come from the posterior triangle. Then are the trunks. They are between the scalene muscles, two scalene muscles. Then the divisions, they are just behind the clavicle. Then the cords and the branches, they are present in the axilla. They are present in the axilla.